Good morning, everyone. And again, I want to start off by saying thank you to our first responders. Can't thank you enough. And if I missed anyone, I apologize. I keep getting questions on that. I appreciate everyone out there, and I want to say thank you, thank you, thank you. Yes, I got criticized for saying thank you too much, but in these times, bring it on. Thank you. Thank you for what you're doing. Thank you for staying home, and thank you for the essential employees out there. Continue to move us forward in this epidemic that we're faced with. I want to thank the governor's office, state DOH, our health department, our hospitals, all our frontline workers, from the bottom of my heart, and I mean that. As of today, we have 574 positive cases, and we have 716 people under mandatory quarantine, 49 people under precautionary. And if you look at it this way, I said this numbers yesterday, we had 1,378 people have completed quarantine. At the ones that there were 282 that were positive out of that batch that have recovered also. Yesterday we had 563, so if you see the numbers really didn't go up that much since yesterday, which is a good sign. Are we plateaued? Are people paying attention? So staying home, doing the right things. It's working, people. It's working. There's 34 people in the hospital. The hospitalization rate is at 5.92%, up a little bit from yesterday. We have 6 adults in the ICU, down 2 from yesterday, which is good. And we're entering the fifth week of this, 5 weeks. And I know we got the news from the governor yesterday, May 15th. It's what we've been saying. There's no magic crystal ball. And I commend the governor. You know, you can be mad as much as people want to be mad at the governor and other people. They're trying to do what's right for the health and safety of the residents of New Yorkers. You'll get criticized if you opened up and you let the floodgates up and people come back to work and people start dying. Is that what it takes for people to sit there and go, well, it's not affecting us. It's not in our county. It's not here in our community. It's here. It's here. So, unfortunately, one of the other things that we've been addressing is nursing homes, and it's been a topic on a not just a statewide level, but on a national level. As President of County Executives of America and President of NISAC, and Steve Aquario is here today with us. Steve, thank you. It's an issue that is a vulnerable community that has been affected the hardest. I actually put on my Facebook last week, I think it was last week, a couple days ago, every day seems the same, about VA hospitals and veterans that are dying at alarming numbers in nursing homes. It's tough. They're our most vulnerable residents, and the health and safety of the workers, first and foremost, and the residents is our mission. You know, and it brings me to the fact that I think my aunt, who's a nun, Little Sister of the Poor, who's been a nun for over 70 years, the mission of Little Sisters of the Poor, taking care of our seniors, our fragile community, people at the end of their life cycle that we're making sure that they're comfortable and that they're having great quality of life. But they're ill. And we've done everything, and that was like before the governor gave his order, we locked down our nursing home. We locked it down before the governor even talked about it for that reason, knowing that we had to stop people from coming to visit their moms, their dads, their sisters, their brothers, their family, their friends, for that reason, to protect the residents because they are vulnerable, they have underlying health issues, and to protect the workers. So, unfortunately, you can do everything in your power, and this is a thing that's kept me up at night, not sleeping. Worried about our seniors because they are the backbone of our community. They're the ones that got us through life. They're the ones that paid their taxes through their whole life. They're the ones that have been out in the community and taught us valuable lessons in life, and our county residents are our people. So it's tough, but as of right now, we have 13 patients that are positive with the COVID-19. And we have 4 workers that are, and actually it was 5, but 1 has recovered, but we have 4 currently. We have been aggressively testing with the state of New York to make sure that, we identify as quick as we can to protect them. And some of the questions you get, well, why didn't you bring it up? HIPAA, there are residents, but first I want to let everyone know, the families know. We contact the families. They are the first ones to know. So it's not that we're hiding anything. It's not, these people have a right to their privacy. It's not like we're trying to say we don't have issues. Everybody's having issues with nursing homes across the state of New York and across this nation. It's a topic that I talk about every week in my weekly addresses to other county executives across this country. So it's not that we're trying to say, hey, no, but I have an obligation to the workers. I have an obligation to them seniors, but I have an obligation also to the families. So we're in constant communications with the families. So I'm not gonna apologize that the press gets a little hurt because we didn't tell them. My obligation is to them people up there. And let me tell you, it breaks my heart every day, you know, because I got to make them phone calls 3 times a day to see how everyone's doing. And they're doing good, by the way. We are still trying to keep things at bay, not just at our nursing home, but here in Albany County. And the only way we can do that is working together in a partnership, taking a deep breath, taking a step back and realizing this is a marathon. I've said this 5 weeks ago. It's a marathon, people. This is not something that's going to end tomorrow. It doesn't mean the floodgates open up, you know, in 2 weeks and people go running out and society opens back open. Am I trying to scare you? No, but if that's the way you're taking it, then take it that way. But we have to work together. That's why New Yorkers are at the best. When we get hit the hardest, we're at our best when we come together and work together to make things happen. To the finger pointers, the people sitting at home complaining, you know what? Thank God you can. Thank God you're healthy. That's all I can say to you. Think of the people that aren't healthy. Think of the people with underlying issues. Think of the people that just need to be protected. And to the essential workers that are constantly out there working, doing things, because they have to go out and they have to work and they have to keep things going. So every time you turn your lights on, every time you turn the internet on, every time you flush your toilet or put your dishes in the dishwasher, that happens because people have to go out and do their jobs. Think of it that way. The results we're starting to see from UAlbany, you know, is good. I mean, the testing that they're doing and the numbers that are coming back, and I'll let Dr. Whalen talk about that. The mobile sites that we started yesterday was a success. We had 30 people show up yesterday. We have more appointments for the next coming days. They're filling up, which is awesome. That's what the intent was. It's intended for walkers, so the people that drove their cars up, we did notice. You can drive to UAlbany. These test sites are for people that don't have transportation. And please utilize UAlbany for the drive-through. And then we'll also be announcing next week another initiative that we'll be launching out into the community, but I'll wait till next week. Again, I want to remind people, if you need an appointment, it's area code 518-465-4771, 465-4771. And also remember, today is the first day effective that people out in public, if you can't maintain your 6 feet separation, got to wear a mask. Got to wear a mask. We're trying to, you know, we're getting them all out to all of our workers. I want to thank everyone who's been making that happen and working in conjunctions with the Sheriff's Office and Sheriff Apple with the EOC for making that happen. Sheriff, thank you as always. And I want to pass over to Dr. Whalen. Dr. Whalen.
Good morning. So I just want to follow along with a discussion about the nursing homes. I know this has been an issue across the country, as the county executive points out, and we've known from the beginning that our vulnerable populations, such as those over 70 and nursing home residents in particular, would be a vulnerable population. From a state perspective, this consideration was made early on, and that's why there was a mandate for all that worked in the nursing home to wear masks weeks ago. In terms of the case investigations for the nursing homes, this is under the domain of the state health department, who provides oversight, but the county is involved in all of these investigations as well. What I would like to say is that these investigations are special and they are hands-on and they are extensive. So when there are positive cases in the nursing home, what the practice has been thus far is that the state comes in and does widespread testing throughout the nursing home. The purpose of this is to isolate cases immediately and appropriately. And we have seen a couple of cases that have come back positive that have been asymptomatic in these situations. There are certainly those that are manifesting illness as well, but the purpose of this, of course, is to make sure that illness is contained and that we limit the spread. And our nursing home partners, certainly on the county level and with other agencies that we are in touch with, have been since day one very involved and interested in doing what they can to mitigate the spread. The concern is there. The efforts for prevention are real. Unfortunately, this is a very contagious virus, and we have seen this impact vulnerable populations. The nursing home is not the only arena. We have seen cases with OPWDD facilities throughout the county as well, and they also have been working with us very carefully to implement infection control measures. We really are trying to partner to make sure, and we've been doing this since day one, to make sure that our vulnerable individuals are cared for, are monitored, and that appropriate testing can be done whenever a case is identified so that we can isolate and control further spread of infection. So this is part of it. We do continue to see cases climb in Albany County, and I know that everyone is probably interested after the president's remarks and the governor's remarks yesterday. I know that there's a lot of restlessness. I know people are saying, okay, we're starting to talk about when we can go back. We're not there yet. In Albany County, we continue to see a rise of cases. Our hospitals are starting to see a slight uptick in the amount of patients that they're caring for, and all of that has to be monitored very carefully, and we are not in any way, shape, or form in a downward trend at this point. So all of the measures that we have discussed to date, staying home, washing your hands frequently, limiting any going out for anything but the most essential errands, and utilizing masks when you are out in public, that all still stands. And that is all something that's going to be important for people to realize that what we do will determine what that curve looks like in the coming weeks. So the responsibility still is on those that are home to stay home, to continue to practice what we have been talking about for the past month. I realize it's difficult. I realize as the days get, as the time gets longer, it becomes frustrating for people from many different capacities, in many different capacities, and in many different ways. But we really need to just keep our eye on the fact that what we are doing is going to control what we can do in the future. And that monitoring that we're doing is essential to inform us as a community what to do next. Right now, we are still in that mitigation stage. We still need to do what we've been doing, and we'll continue to follow this along. We'll share information as we get it, and hopefully in the coming weeks, we will be able to have different considerations.
Thank you, Dr. Whalen. And I do want to say thank you, because you do not understand the amount of stress and workload that the health department's been taking on, and you've been doing it extraordinarily well. So thank you for everything that you're doing and continue to do. And some of the other essential services that need to continue: Crime Victims Hotline, SNAP, people without food, people that are out of work, those who are homeless have to be placed. We're dealing with the, obviously, with the homeless population and walking our streets, making sure they're off their streets, making sure that they're in housing. So there's a variety of stuff that we continue to do that have to get done in the community. But our guest today I asked to come is Steve Aquario, who's the executive CEO, I want to say, of New York State Association of Counties, who does a great job. But some of the things we've been working on, again, is government continues on. And I can't thank NYSAC enough for their leadership not just on this COVID-19, but day in and day out, when the budget was still going on, talks were going on, Medicaid issues were going on, and we're faced with this. Steve took a lot of burdens off of counties across the state of New York so we could concentrate on this, but still concentrate on the things that are vital to our budgets day in and day out. And one of which is on a national level. I'm hoping everyone who celebrates Easter had a nice Easter, but I can assure you my staff, myself and Steve, spent Sunday pretty much 20 hours out of the day dealing with a national issue that with the fourth stimulus package coming out of D.C., that money indirectly was going to go to cities and not to the counties that are facing and paying the bills. And that meant the city of Albany would have got a tune of $54 million and the county would have got nothing. So we had to address that issue on a national level. We were working with NACO, and we're also working with County Executives of America, what I'm president of. And we're dealing with delegations from California to Florida to Georgia, from all over, all day Sunday to get Congress. And I want to thank Congressman Paul Tonko for helping us on this issue and everything he did, and all the other congressmen. But it's issues like this that we can't brief every day on or talk about, but has a huge financial impact on us going forward. So I want to say, Steve, thank you for all your hard work, but I'm going to let Steve talk about everything that they've been doing on top of that and everything else. Steve, please.
Thank you, County Executive McCoy and Dr. Whalen. It's nice to be with you both to talk a little bit about what's happening around New York State and what's happening in Albany County. The first thing I want to say is that there is nobody in the county of Albany that cares more about the residents of the Albany County Nursing Home than County Executive Dan McCoy. Nobody cares more about them than the County Executive of Albany. I know his passion. I know his commitment to keeping that home as a viable option for people of Albany County to spend the last few years of their life, the expansion of that, the cleanliness of that facility, and what that means to these people of this county. And it breaks his heart. It breaks all of our hearts to hear the impact of the coronavirus in nursing homes, in Albany County, in Warren County, in Rensselaer County, in Steuben County, in Suffolk County, in all of the counties of New York State and around the United States. These are indeed our most vulnerable. In addition to persons with disabilities, these are our most vulnerable people. And the fact that County Executive McCoy moved as quick as he did with Dr. Whalen to make sure the protocols were put in that facility early on will have saved lives for many. And I commend County Executive McCoy for his early action and innovation and commitment and courage and a sense of community to protecting the people of this county, and Dr. Whalen for all the work of the local health department and the function of county government to stop the spread of this disease. I forgot to wear my mask when I got out of the car today. Why? It's not a habit. It's not a routine. But it's going to have to be a routine. As County Executive McCoy talked about tonight at 8 o'clock, we all have to wear the masks. We have to make this a habit, a routine now. It will save lives. It will protect yourself and your family. And I commend the work of County Executive McCoy to help stop the spread and the early action and his leadership in Albany County and his leadership across the state with other county executives and his leadership in Washington, D.C. We can't do this alone. We need Washington, D.C. We need to have the leadership of Senator Schumer. He is the Democratic leader of the United States Senate, representing all 50 states, the territories of the United States. He's our senator. We need his help. Albany County needs his help to bring resources to this regional government who's primarily responsible for fighting this corona pandemic. The federal resources are crucial as sales taxes are declining by the day. We just got the report from March of sales tax, down dramatically in automobile dealers, down dramatically hotel occupancy taxes, down dramatically in clothing sales, Down dramatically in gasoline. Why? People aren't driving around, and they shouldn't be driving around. We're going to go through a period of time where we're going to be seriously economically hurt, disadvantaged, and we need to continue to provide the services. You heard the county executive talk about how the county serves the residents, the community needs, supplemental needs assistance, temporary assistance. People are hurting, people are struggling, people need their medicine. And thanks to County Executive Dan McCoy for all that he's doing for the people of Albany County, we need Washington to help us. So this is a desperate plea to urge our delegation, our congressional delegation, to help our governor with the needs of the state, but also so too to help our county of Albany. County Executive McCoy, thank you very much for having me here today.
Steve, as always, Steve, thank you, and it's a great pleasure working with you. And again, thank you for taking care of us, not just on a statewide level, but on a national level, Steve, to you and your organization, to everyone that works for you. It's been a pleasure getting to know you a little bit closer because of what's going on a national level, but thank you, thank you, thank you. I want to also say we got a donation of some face shields for our mobile testing sites, the shields which are being produced at UAlbany by the students. So I want to thank UAlbany and the president there for making that possible. So that's helping us out and getting the shields out to where they need to be. The facility and the students in the Department of Electronic and Computer Engineering at the College of Emergency Preparation of Homeland Security and Cyber Security have made this happen. So thank you, thank you, thank you. And then a big thank you to the Feed Albany and Savoy Tap Room, which is providing food to our staff at Shaker Place Rehabilitation Center. So thank you, Jason Pierce and everyone there, and to what you're doing. Can't thank Feed Albany enough on top of everything else that you're doing. And then, you know, we have a beautiful picture from Shaker Place, the staff there pitching in on the 518 Rainbow. So I want to thank them for that. And they put a big smile, not just on my face, but everyone else. So thank you. And as always, the hotline number, mental health, 8 days a week, 7 days a week, 8 a.m. to 8 p.m. And the number is 518-269-6634. 269-6634, and as always, the 211 number in the New York State hotline. Thank you, thank you, thank you,